Hi everyone, it's Dr. B with Bellissima Dental Boutique, and today we're going to be discussing teeth whitening. Okay, so what is the purpose of teeth whitening? What it is and what is its purpose? So teeth whitening or teeth whitening procedure is just here to brighten the appearance of your teeth. That's the purpose. What is it? A lot of times it is just a gel that is applied to your teeth that has an acid that is used to break down the surface stains of your teeth. So there's several different types of whitening options. We have the things that you can buy without a prescription in the tooth care aisle. So that means your whitening trays, your gels. Those are excellent options to start if you're not sure that you're ready to make the financial investment in having professional teeth whitening done. Then when you come to your dentist, a lot of times there's two options, in-office whitening and take-home whitening. Here at Bellissima Dental Boutique, we use core whitening. It's one of the most advanced dental whitening systems that is available on the market. They ship it to us on ice and we store it in our refrigerator. You don't sit under a blue light. This whitening system allows us to have maximum benefit with minimum side effects. A lot of times with teeth whitening, people will say that their teeth feel very sensitive. They have what we call zingers, meaning that when they're eating something cold, even when they take a deep breath in, they can feel a sharp sensation that kind of goes through your teeth. That does get better with time, but we want to try to avoid that if possible. So with the take-home whitening, you would come in for your appointment, we would scan you, send that scan to the core whitening lab, and they'll fabricate whitening trays that they'll send back to us. We have the gel in office, so once we get the trays back, we call you, we say, hey, your trays are in, you ready to start your whitening? We usually let you whiten with take-home gel every night for 2 weeks to see how those results are working for you. After that, you come in for a post-op. We review, we say, hey, we like it, and we'll just keep you on a maintenance, and we'll usually do maintenance at least once a year. Or if you want whiter teeth, then we may suggest doing an in-office whitening treatment. For our in-office whitening, we have you come in, we book you for about an hour. We give you headphones, you get to listen to music or watch TV, relax. And we add a barrier for your gums so that whitened gel stays on your teeth and reduces the probability of having sensitivity. We have 3 rounds of whitening that we go through. Those sessions are 20-minute sessions. So we paint on the whitening gel, we let you sit for 20 minutes, you're relaxing, we rinse it off, and we then apply another application and do that at least 2 more times. After that, we rinse you, we give you a desensitizer. I always like to add a little bit of fluoride after just to make sure that we are decreasing the chances of sensitivity. I tell patients that if you are going to whiten their teeth, things that you should incorporate into your oral hygiene are fluoride-containing products or products, if you're anti-fluoride, products that contain hydroxyapatite. That's going to help you remineralize your teeth and also help decrease sensitivity. So what are some of the pros and cons for these different type of whitening options? Some of the pros for an at-home whitening system is that it's of lower cost. That means that it's not going to cost you a ton to invest and to get started to see if whitening is really something you want to commit to, or maybe you even get the results that you're looking for using a Crest White Strip or a gel or a toothpaste without spending all the money of coming into an office. It also can be done at your convenience, so you're not blocking up time, making an appointment, taking time off work. It can be done at home. You can get the strips at any time and use them at any time. One of the cons is that it's less effective, and it's also not customized to your smile, meaning that that acid that is there to lift the stains off your teeth can actually lead to more sensitivity because there's nothing sealing that gel around your teeth, preventing it from leaking and causing tooth sensitivity. Some of the pros of a take-home whitening is that you have customized trays. You're not worried about deactivated material or deactivated substance because it's mixing with your saliva. There's decreased tooth sensitivity, and you're going to have better results than if you were to do an at-home whitening system that you pick up at a convenience store. But some of the cons still are that you still may not have maximized results. It is more expensive. So the take-home whitening trays do require consistency. So if you're going to invest in it, we want you to use it for however long it's prescribed, for the amount of time it's prescribed, and for the length of time. Some of the pros with an office whitening would be that we take care of all of the responsibility for you. You come in, you relax, we do all of the work. So within an hour, you can actually leave with a brighter smile. You're not worried about having to place trays or strips every night and being consistent. You come in, we take care of all of the heavy lifting, and when you leave, you have a brighter, happier smile. The con is that you do have to take time off of work to come in, and it does typically cost you more money than if you were to do the take-home trays or the at-home option. But you will have the most maximized results by coming in and doing in-office whitening. So I'm going to be addressing some of the common questions when it comes to teeth whitening. Is teeth whitening safe? Teeth whitening is very, very safe, especially if you are coming to see a dentist, if we're doing in-office or take-home, just because we are burying your gums, we're giving you a custom tray, you're not ingesting a whole lot of the teeth whitening material. Teeth whitening is definitely safe. However, if you are pregnant or breastfeeding, we may want to hold off with teeth whitening until we're out of that phase of life and you're ready to focus on yourself and bring back that smile. Can teeth whitening damage your gums or tooth enamel? The short answer is no. It can lead to increased tooth sensitivity. And so we want to make sure that we're using desensitizer, fluoride, or nanohydroxyapatite to make sure that we are remineralizing and decreasing tooth sensitivity. But for the most part, studies have shown that teeth whitening is both effective and safe for us to do. The important question, how long does teeth whitening last? You've made the investment, you decided you're going to whiten your teeth, and you want to know how long teeth whitening lasts. Of course, like any procedure, we're going to give you post-op instructions, foods we want you to avoid, drinks we want you to avoid. But actually, how long your whitening results last is completely up to you. So avoiding red sauces, avoiding red wines, drinking coffee and tea through straws instead of swishing it around in your mouth, all help prolonging the teeth whitening results. So even if you do find that you're out or you're socializing or you get back into your normal morning routine and you realize, oh, I've had coffee, I've had tea, I didn't drink it through a straw, that's okay. After 30 minutes, just go ahead, brush your teeth, or at least swish with water. And that's going to help remove that food or that tea or that coffee from sitting on your teeth, creating those stains that then set in and darken your teeth. We also want to schedule maintenance for teeth whitening. So if you are whitening your teeth for a big event, we want you to whiten your teeth ahead of time, give yourself plenty of time, and then we want to at least try to whiten your teeth for maintenance once every 6 months. And what maintenance looks like is different for everyone. Some people, it's another round of whitening gel that you have in custom trays. For other people who know that they're not as regimented and they're not going to be as consistent with whitening gel, then we may say, okay, in 6 months and a year, let's do another round of in-office whitening just to help maintain your results. But the length of your teeth whitening results is definitely patient dependent, how compliant you are. Also, again, everything goes hand in hand with your oral health, making sure you're brushing, you're flossing, you're coming in for your regular cleaning. All of those things and staying on top of that is going to help prolong the whiteness of your teeth. The cost of whitening can vary from office to office, the systems that they're offering to use, whether it's take-home or in-office whitening. One thing to remember is that for a lot of times, teeth whitening, or any cosmetic procedure is not covered by our dental insurance. So you do need to prepare for an out-of-pocket cost. A lot of times you can use your FSA or your HSA to pay for your teeth whitening treatment. So if you're in the Fayetteville or surrounding areas and you're interested in teeth whitening, please feel free to give Bellissima Dental Boutique a call at 910-778-1229 or schedule an appointment and consultation online at www.boutiquedentalandimplants.com.